why the 6Cs and not some other initiative? What led you to the 6Cs?
The 6Cs were built on Energised for Excellence, which was a programme that I was running nationally before I was appointed as the Chief Nursing Officer for England. And that was based around improving excellence in nursing and midwifery across the board. And when I was in the sort of preparation phase for applying to become the CNO for England, I spent quite a bit of time talking to frontline staff and just testing out ideas and what people thought was important. And one of the things that came back quite significantly was a need for something that really described what the professions do in a way that was simple and tangible.
That brings me to, how will you measure the outcomes? Or do you intend to measure the outcomes, or perhaps not?
Well, one of the things we're doing is we're looking at how organisations and individuals and teams are using the 6Cs to change practice and improve care for patients. So at the end of the day, the thing that's really important is, do they make a difference to patients and
carers?
carers?
An initiative that will just run and run?
I hope so. One of the things I'm really clear about is this isn't me as the Chief Nurse for England saying you must do it and you must use the 6Cs. What we've said is this is where we think what we think is important. These are the reasons why we've chosen them. We think they are meaningful. We think they're meaningful for staff and patients. That's what you've told us. If you want to use them, then it's a really good way of sort of setting your strategy around care and compassion and delivering really good care wherever you work.
So do you think that nurses in primary care feel that the 6Cs are as relevant to them perhaps as hospital nurses?
I think they certainly are as relevant. They're relevant to everybody. Have practice nurses engaged as much? I think it's mixed. I think some are really engaged with this and some maybe not as much. I think for us it's about being able to get into that network of practice nurses across the country, and we know that some find it more difficult to maybe step out of their day-to-day work in a GP practice to actually look at some of the other issues that are going on slightly outside of that immediate field. But we have got some really good examples. We've done some frameworks around practice nurses and how they can use the Cs. We've done it with community nurses, and each of those Cs is as relevant in a practice nurse's role.
Sometimes I hear that. That sounds fantastic. But sometimes I hear that perhaps GPs aren't always behind the nurses. How do you think that nursing as a whole can address this or address that issue?
I think it's a couple of ways, several ways. One of the ways is to demonstrate, to actually show what good work nurses can do in those settings. So be prepared to, write about it, speak up, show it, tell their stories, put articles in, publications like yours which describe some of the work they do and what the outcomes are. So I think that's one thing.
Many people many nurses struggle, I think, with leadership roles. And so I know you can't explain exactly how you've got to where you are today, but what would you say perhaps to people who were nurses who'd like to move more into leadership? And is there anything from your experience they can learn?
Well, I think firstly I would say that whatever job you do, you're a leader. So as a newly qualified nurse or midwife, you are still a leader because you are making decisions about your patients, you are assessing them, you are planning care, you are communicating with them, you are using the 6Cs to do the job. And in the eyes of the patient and their family and their loved ones, actually you are a skilled professional there to do a job, so you are, in many people's eyes, a leader. And very, very quickly you start to support junior staff. You would work with students, you'll work with maybe healthcare assistants who aren't qualified as in registered nurses or midwives. And so I think you are leaders at a very early stage. We've all got the same aim, which is around providing the best, safe, effective care for patients and the best experience, and doing that in a way that means something. Because for patients, as the sort of Maya Angelou's quote says, they may not remember what you say, they may not remember what you do, but they'll always remember how you made them feel.
Mm.
And I just think that's so important.